Welcome to the Databricks Tech Talk, the complexities around COVID-19 data. We're really excited to have the members of the Data Science for COVID-19 team, also known as DS4C, here to talk about the trials and tribulations of collecting the immensely interesting COVID-19 dataset in South Korea. My name is Denny Lee, and I'll be one of the hosts for today's session. I'm a developer advocate at Databricks with a background in Apache Spark, as well as internet scale data engineering, including at Bing, SQL Server, Project Isotope, the incubation project that is known as HD Insight, and Azure Cosmos DB. And I also happen to have a background in healthcare life sciences, including a master's in biomedical informatics. Our co-host for today's session is Vinny.
Thanks for the introduction, Denny. Hi, I'm Vinny Jaiswal, Customer Success Engineer at Databricks. I work with companies in different verticals to strategize and implement data and AI and machine learning use cases. My background in data science also includes working as a lead data science engineer at Citigroup, data analyst at Southwest Airlines, and a master's from UT Dallas. Let me tell you my story of DS4C. Personally affected by business travels to the US cities where initial COVID-19 cases were reported, I was extremely worried, left in questions. My family was worried and curious since the case numbers were flying at us. This led me to research on COVID-19 data for data-driven insights. I found 3 to 4 sources online and DS4C data caught my attention, mainly because of the level of details including route information, policies, patient data, recovered versus confirmed cases, etc. Having access to that level of detailed data really mattered at that time. Without hospitalization and outcomes data, we can't understand how deadly the virus is. We couldn't figure out how the spread is happening. DS4C researchers were working day and night to make this data available to the community so that they can do the research. I used this data another time for a Delta notebook for an online Apache Spark meetup. And as Denny and I were reviewing the content, we realized how important this data is. So Denny decided to change the meetup to online COVID Tech Talk instead, so that we can raise data awareness to the wider community for COVID-19 research. Ever since then, Denny and I have been working very closely with DS4C team on different data research efforts and publications. Now let's hear from Isaac himself about the data science for COVID. Thank you.
Thanks for the introduction, Vinny. Hello, I'm Isaac Lee, a junior at Carnegie Mellon University studying computer science. I'm also a software developer team lead at MindsLab and the director of DS4C. On behalf of all the team members, thank you so much for this valuable opportunity to share our work with the data science community. After 2 years at my university, I came back to Korea to serve in the military. And when COVID started to spread within Korea, I witnessed the everyday lives of my coworkers, friends, and family steadily deteriorate. So I decided to look for what I could do, and I knew that as an undergrad, with my limited knowledge and experience, I wouldn't be able to do something impactful and glamorous, like inventing a new ML model. So soon after a brief search, I found out that despite all the valuable data that the Korean CDC was collecting and publishing, nobody had yet organized and processed the raw data into a single coherent dataset that could be analyzed and studied by data scientists. So, with 3 other friends at Seoul National University, we started to build the Korea COVID-19 dataset. And it was, in fact, far from glamorous. But we plowed through in the hopes that maybe, if we are really lucky, a couple of teams of data scientists would find it interesting and discover meaningful insights. However, within a few days of publishing, our dataset received hundreds of likes on Kaggle and GitHub, and other data scientists reached out to join our efforts. We were completely blown away, and it would be foolish to take these for granted. So I'd like to share my sincerest appreciation to all of you who find interest in our dataset. Your work is what gives meaning to our endeavor. Now, I'd like to let a few of my teammates introduce themselves.
Hello everyone, I'm Seojin. I'm an undergraduate student majoring in French language and software conversions at Yanghi University, South Korea. My role in this team is project management, managing the workload of the dataset update. I am also working on an academic paper of our dataset and research based on the SCIRS Plus model. I first joined this team when Jiu Kim, our project leader, asked me if I was interested in building the dataset of COVID-19 cases in South Korea. I thought this was a great chance to learn and think about constructing the dataset under the premise of good usability for research and analysis. And most importantly, why I so much care about this dataset is that our dataset could be a great material in getting COVID-19 insights, since our government has been providing a lot of information about it.
Hi everyone, my name is Donghan Zhang. Currently, I'm in charge of the paper writing team as a senior research engineer in DS4C. What I do is add credit to our dataset by publishing our paper. We believe that this will help machine learning researchers to more easily reference our dataset. I'm a master's student at Seoul National University, and I'm doing research on universal image restoration in computer vision lab. I started to join DS4C team with the belief that the Korean dataset could be of great help in providing corona-related insights to global researchers. In the early days, I helped with project management with Isaac Lee, but recently I'm working on submitting our paper to dataset journal called Scientific Data, as I mentioned earlier. So my goal is to help many people suffering from coronavirus as much as possible through reliable, detailed DS4C dataset. Thank you.
Hello, I am Jimmy Kim. I am a senior research engineer at DS4C. I am especially in charge of collecting policy data. It is collected what policies the Korea government implemented by the date based on the report of each ministry. For example, the data such as when the elementary school started and when the middle school was opened. Before I started my PhD in statistics, I worked for 8 years in the Korea government as a public servant. Every time when I worked on law and policy, I wanted to know about how it affected people. I would like to find out more about what policies as an intervention effectively works in this pandemic situation. And I think it would be good to use these data sets to do such as causal inference for public policy study.
Thanks for the introduction, guys. Now, let's talk about the COVID-19 Korea dataset. First, who are we and what do we do? We're a non-profit, volunteer-based organization named Data Science for COVID-19, or DS4C in short. We're composed of 16 undergraduate and graduate students from different universities in Korea and America, and we've built, published, and maintained South Korea's COVID-19 dataset. The DS4C dataset is currently ranked the third most impactful dataset on Kaggle, with over 50,000 cumulative downloads and 300 unique contributors. What makes the DS4C dataset so potent is the sheer amount of data collected for each patient. The Korean government has been collecting and releasing patient information with unprecedented levels of detail. The data released includes infected people's travel routes, the public transport they took, and even the medical institutions that are treating them. And this extremely fine-grained details is what makes DS4C dataset so valuable. The most used COVID-19 Kaggle dataset is the White House dataset, followed by the Johns Hopkins dataset. And the popularity of our dataset is seemingly puzzling, because unlike the two datasets, which cover the entire world, our dataset only covers South Korea. So why would a dataset with such a small sample size and narrow scope have so much research potential? As I've highlighted previously, we attribute the potency to the high degree of details, and let me show you a snippet of our data. The above is a snippet of our dataset, and below is from Johns Hopkins dataset, which is the most cited dataset so far. First, let's take a look at the Johns Hopkins dataset. It contains 3 major pieces of information about each patient: the age, sex, and municipal district where the patient was infected. Now let's take a look at our dataset. The first few columns enclosed in blue box are age, sex, and city, which is identical to the Johns Hopkins dataset. But what's really interesting is the data in the columns enclosed in the red box. That data is absent in the Johns Hopkins dataset and, in fact, in all other datasets. I'll explain each column one by one, starting from the left. First, we have infection case, which describes the avenue through which each patient got infected. Let's take a look at the first row of the table. The infection route of the first row patient is overseas inflow. Overseas inflow is when a patient got infected outside of Korea and traveled into Korea. The infection case column tells us how each patient contracted the disease, and overseas inflow is just one method amongst many. Let's take a look at one more example. The patient in the third row was infected by coming into contact with another patient. And what's amazing is that we're able to identify the specific patient who had spread the disease to the third row patient. If a patient's infection route is contact with another patient, then the second column, appropriately named infected by, specifies the patient ID of the infector. What that implies is we're able to construct a transmission network where each node is a specific patient with a patient ID, and edge is a transmission from one patient to another. And we believe that this transmission network is extremely powerful. For instance, in our research with Harvard Medical School, we were able to identify Korea's success at curbing the spread of COVID-19, and the paper was published last month at International Journal of Infectious Diseases. We'll dive deeper into it in our next talk section with Steve. He'll talk about how the transmission network was used in our research, and how you could use them in your research to bolster your findings. In the third column, we have the cumulative number of people each patient came into contact with. You can see that the first row patient came into contact with a total of 75 people. In the final column, we have self-reported symptom onset dates for each patient, and the first row patient's symptom started on January 22nd. So you saw the abundant patient data that our dataset contains. But this isn't all that makes the dataset special. Beyond the patient information, we have patient travel routes. It's data on every location that undiagnosed infected people had visited before they were diagnosed and quarantined. And for each location, we have the exact latitude and longitude, the date and time of the visit, the type of facility the patient visited, and where the patient was wearing a mask, and the number of people the patient came into contact with. Beyond the patient information, we have patient travel routes. It's data on every location that an undiagnosed infected people had visited before they were quarantined. And for each location, we have the exact latitude and longitude, the date and time of the visit, the type of facility the patient visited, whether the patient was wearing a mask, and the number of people the patient came into contact with at the location. And this information is extremely precise and accurate, as it has been crafted carefully by the Korean government by synthesizing each patient's credit card history, cell phone GPS locations, and security camera footages. The patient travel routes, coupled with the transmission network, can tell us the exact location that a patient had gotten infected, who the patient got infected from, whether the infector was wearing a mask, and what type of facility they were using. We haven't released this data due to privacy concerns, and we're currently working with the Korean government to sufficiently anonymize the data before releasing. We're very excited to release this data because we think it will enable research that couldn't be imagined before. So keep an eye out for it, because it'll be released within a month or two. Next, we have mass outbreak cases data. It contains information about each COVID-19 mass outbreak case in Korea. Let's take a look at the first entry. In the infection case column, it says Itaewon clubs. We try to make the name of each case self-evident. So from the name, we can tell that the first case broke out at clubs in a district named Itaewon. Under the confirmed column, you can see that the total number of people who got infected is 139. Now, do you remember the infection case we had for each patient in the first snippet of our dataset? What makes this data so interesting is that the infection case for each patient is mapped to one of the cases in this table. This means you can pinpoint at which case of the mass outbreak the patient contracted the disease and analyze the unique characteristic of each mass outbreak. Next, as more researchers are trying to identify the effectiveness of social distancing policies, we've included data on the social distancing policies enacted by the Korean government. What I've presented to you so far is not an exhaustive list. This is a schema of our dataset, and it shows how each table is related to the other tables. The ones we've described above are tables enclosed in dotted yellow lines, and you can see that the dataset contains much more peripheral data, such as Seoul's population flow data or Korea's search trend data. Now, that was a mouthful, so I'll summarize it again. If you were to take only a single screenshot from the entire presentation, then this would be the one. To recap, in the first table, we have infection routes of each patient, which allows you to construct a transmission network. In the second table, we have patient travel routes alongside critical metadata of each travel location, such as whether the patient was wearing a mask, what type of facility they were using, or how many people the patient came into contact with. The third table contains data on major outbreak cases in Korea, and the last contains description of each social distancing policies enacted by the government. Finally, our dataset contains other peripheral data, such as Seoul's population flow timeline and medical supplies in each district. Although our dataset is already rich with fine-grained details, we're constantly scouting the ever-shifting COVID-19 research landscapes in order to reinforce the dataset with newly discovered potent data. Once we identify the valuable data, we contact the Korean government or large hospital institutions and obtain raw data from them. Finally, we clean, quantify, and organize the data into a logically coherent table that can be used by data scientists without any additional pre-processing. For example, in the last few months, a series of papers hinting at the potential benefit of BCG and MMR vaccines have been published. For instance, the Federal Reserve Bank of New York analyzed the drastic difference in death rates between East and West Germany and concluded that the main contributor to this difference has been the discrepancy in BCG vaccination rates. And in response to the growing attention on BCG and MMR vaccines, we've added BCG and MMR vaccination rates of Korean into our dataset. So far, I've talked about the content of our dataset. Now, we'll dive a little deeper into what DS4C has done and what problems we were able to solve for the data science community. All of the data in our dataset has been collected and made available to the public by the Korean government. However, the government hasn't been able to create a coherent dataset of the data that they have already. In fact, due to their severe lack of manpower, the government doesn't even have collection of COVID-19 patient data collected at the municipal district level. And unfortunately, the published data in its raw format is rendered useless to the data scientists by these three problems. First, decentralized publication. Second, lack of unified formatting. And last, the data that is embedded in natural language. The first challenge is accessing the raw data published by the government. The collection and publication process of patient information is extremely decentralized. Over 100 municipal districts each collect patient information within their district, and they publish the data on each of their own websites. Yes, that means in order to access all the published data, a data scientist has to scroll through hundreds of pages. And when new patient information is released, one has to go through all the websites to obtain the new data. This problem is further exacerbated by the lack of unified formatting across all the municipal districts' websites. Some websites upload data in a table, others in a Word document for each patient, and some even go as far as uploading screenshots of the data in JPEG. Only to make things worse, the website's HTML changes midway through, and even the types of data collected varies widely from one district to another. These obstacles render web crawlers obsolete, as writing a web crawler for each of the district's websites and updating them when the website's HTML changes is far more time-consuming than manually going through hundreds of web pages. And manually going through hundreds of web pages weekly was exactly what we did to collect the data. After collecting the data in a single table, we need to parse and quantify data embedded in natural language. The sentence in the red box is how the raw data is presented to us. I'll read you the sentence. April 7th, patient 136 visited a barber shop near Gangnam Station, exit 3, went back home, then went out to 7-Eleven in front of his house. From this raw data, we need to parse out useful information, such as patient's travel routes and symptom onset dates, and all the data that you've seen in our snippets. We've tried multiple rule-based methods, but due to the absence of unified formatting, such methods yielded extremely high error and omission rates. Again, we had to resort to manual labor. But midway through, we realized that due to the sheer volume of data, it was infeasible for us to pre-process the data with bare hands. On average, each patient had 5 to 10 of the sentences you've seen, and there have been 15,000 patients by the time of writing. That leaves us with a total of 150,000 sentences. So we decided to look for ways to make the process more efficient. And with MindsLab, we've developed an efficient data engineering tool that accelerates the process in order of magnitudes. And thanks to the efficient tool, with only 16 part-time data engineers, we were able to generate patient data in near real time. This last section is meant to be a preview of what Steve and Sujin are going to discuss in the following talk. In our next talk, we'll dive deeper into some notable papers that have discovered meaningful insights from our dataset. Additionally, we'll talk about the collaborative research DS4C is conducting with Databricks. Currently, dozens of world-class research institutions, including Harvard, Microsoft, and F. Zurich, are analyzing our dataset. And numerous papers have cited our dataset as the primary source of their research. I'd like to talk more about some of the papers, but we'll save the best part for our next talk, so we can dive sufficiently deep into the studies. As I've previously mentioned, we have published a paper with Harvard Medical School in the International Journal of Infectious Diseases. Steve will talk more on how our dataset was used in the papers, including the one we've published. Additionally, we're also working with Databricks in applying state-of-the-art prediction models, such as Cyrus Plus, to our dataset. Sujin will share some of our exciting research goals also in the next talk. Now, that was a detailed description of DS4C and our dataset. Again, Thanks so much for joining our talk, because your interest in the dataset really means a lot to us.
I'm going to walk you through the impact analysis of COVID-19 in South Korea. This dashboard is built on BI tool called Redash and powered by the data made available by DS4C. This is updated to the latest version of information from July 13th, 2020. South Korea's number of infections were once second highest in the world after China. The virus infected almost 25.9 million people worldwide in over 210 countries, South Korea being one of the least hit. Let's start by looking at the impact numbers in South Korea. Because of the latitude and longitude information available in the patient's route data, I was able to use map markers visual from Redash. This helped me identify the impact of COVID-19 on the South Korean provinces. Looks like Seoul was hit the hardest. Out of 51 million total population, 12,800 is the total number of COVID-19 cases, accounting to about 0.002% of overall South Korean population. Out of this, 2% is the fatalities and 90% is the recovery rate. Also from this graph, we can see recovery rates were significantly higher than the death rates in South Korea. Now, let's do some analytics on the internet search trends and some spread reasons. Internet searches for cold, flu, pneumonia, coronavirus started surfacing the internet beginning January. That was the time we started knowing about the existence of COVID-19 from Wuhan. These keywords remained top internet search trends throughout January. In the mid-March is when the search trends spiked again. And we know why. This was the time when it started spreading rapidly in the United States. Let's walk through how coronavirus entered South Korea. Route data, which was made available by DS4C team, helped me understand the origination of cases. The first COVID case in South Korea likely originated from the airport around January 20th with the tourists from Wuhan, China. Here's a map of first few cases in South Korea. Gyeonggi-do, Seoul, Incheon, Daegu were some of them. You can see from this word cloud that Gyeongsang-buk is one of the highest impacted regions. President Moon had declared it as a special disaster zone. To get to more details, let's look at the number of cases per day. I'm going to use some related information which we know from the news with this time series trend. That way we can get more sense out of the data. So this bar chart shows clusters starting from end of February 2020. The cases peaked at about 909 on February 29th, resulting in increased alerts about the disease. There was a special case of 31st patient known to be a super propagator causing the pandemic to surge in Daegu. The mass infection of Shincheonji church followers was all over the news and media, increasing the cases uncontrollably, and it became the center of intense scrutiny. This led to local government admin orders, diagnostic kits were launched, people started social distancing, they wore masks. So the first wave lasted till April. On 17th March, around 79 church devotees were infected with the virus after attending the River of Grace Community Church. The infections were claimed to have been caused by spraying salt water into followers' mouths, under the belief that this would protect them from virus. This led to the spike in cases again. On 30th March, Seoul became the cluster with 22 infections linked to the gathering in early March, in which the group was preparing stock footage for use for online worship services. Slowly, the COVID-19 started getting in control with all the isolation, governmental measures, and whatnot. On May 11th, however, there were 79 cases linked with the clubs in Itaewon, leading to the policy of closing clubs and karaoke's. Let's look at the spread of the disease. So, as we know, contact with patients and overseas inflow. These are some of the top spread reasons. And that sounds about right. It resonates about the general understanding of the infectious disease that spread, is through patient's contact and came from travelers. Now, if we want to further understand the policy enforcement, let's look at it. There were various policies: emergency use of diagnostic kit, mass distribution, infectious level disease alert, social distance campaign, mass distribution, school opening delay that was impacted, then school with online classes, wearing of mask became very significant, extents of quarantine measures, and it kept going. So that was about some analytics on spread. Let's look at some of the root cause analysis. Now, if we want to understand about patient demographics, for example, who is likely going to get the disease? Does age or gender play any role? This green trend here pops up a lot because of how dense it is. These are the patients in their 20s. The second most dense is the pink line. These are the patients from 40s. And age may or may not have correlation. Maybe people in their 20s are not social distancing and other age groups are more intimidated to go out given how deadly the disease is, and they might be taking self-precautions. So this doesn't help. Let's look at more data. Let's look at the recovery versus deceased. Looks like the disease does impact people with old age, since the recovery ratio is lower than compared to lower age people. So it definitely has a correlation with the age. Now let's see if gender matters. Disease ratio of male looks higher than female, but there could be more details we should look into. So let's look at the number of cases distributed by gender. The pink shows the females case reporting and blue shows male cases. So this doesn't help to conclude if females are more prone to recovery than male, because number of female patients looks higher than male. And that may be why recovery numbers were also higher. Let's look at patient state data. It definitely shows that the patient's recovery rate is significantly higher than the deceased ones in South Korea. This can be correlated to how the South Korean government was prepared to test over 200,000 Shincheonji followers during the first wave. This shows Korea's preparedness and how they were able to defeat the disease. Hope you find this analysis useful, and thanks for attending the session.
Before we go to the question and answer portion of this session, I want to thank the members of the DS4C team and Vinny for an awesome presentation. These are unprecedented times with COVID-19, and we wanted to give a shout out to the DS4C team for showing how the data community can help. 16 students decided on their own to build a centralized data store of Korean COVID-19 cases that is now the third most popular COVID-19 dataset, with details not readily available in other datasets. As Isaac had noted earlier, we are scheduling a second session. It will be announced shortly, around some of the research as well as the modeling around this data. In the meantime, if you have any questions, please ask us here in this session. Drop us a line on the Databricks YouTube channel. We're going to post this up there next week, or contact DS4C directly. Thanks very much for attending today's session, and without further ado, let's get to those questions.
So Isaac, you mentioned a lot of it was manual and each district data was worked on by separate individuals. That must be very challenging and time-consuming work. Can you explain the data engineering process and tools you used to allow your team to capture all possible data?
Yeah, so initially our data collecting process was very down to ground because we weren't planning on. Our goal wasn't to publish a data set with perfect quality. It was to gather something so that maybe people somewhere may find it useful. So what we initially did was literally copy and pasting data that was published on each of the district's website onto a Google spreadsheet for us to process later. So, and one of the challenges that added on to the difficulty of creating the data set was that each data was ephemeral. They only lasted for a couple of weeks, and it wasn't even guaranteed that they would be up for a couple of weeks. It was actually dependent on when each government or each municipal district felt comfortable deleting the data. So our task was so we had a time deadline for each data point, because if we didn't collect them on time, then they would be lost permanently. So with a time restriction, our initial plan, what we initially did, was to literally just copy and paste each patient's data onto Google spreadsheet for us to process it later. And once we were able to collect a significant amount of patient data, it was only then that we started thinking about how are we going to process the data. And so that's when we worked with MindSlab together to create an efficient data engineering tool. And what it allowed us to do was it allowed us to process all the data that was sort of jumbled on a Google spreadsheet somewhere, and actually extract meaningful information out of it.
Got it. That was helpful. So how are you ensuring the data reliability then?
One of the methods we used was collaborating with other nonprofit organizations that were collecting data. So in Korea, a few websites like Corona Board or Corona Map have been collecting data on their own, but they haven't published it, or they haven't collected and distilled it to the degree that would enable data scientists to use them. What we did was we were able to get help from them and get the raw data they collected, and we would often compare the data we had with the raw data we had against theirs. And the raw data is copy and pasted from the website, so there isn't a large degree of a large margin of error. But having that accurate raw data allows us to compare the process data against our raw data. So in a sense, we can at least be ensured that we have a reference that we can refer to with confidence. And so based on the complete raw data, we would go back on our process data, randomly sample a couple percent. That's what we've done so far, and ensure that the accuracy of the data was at least above a certain threshold. And if it weren't, then we would often do an entire sections or entire cities worth of data again.
Oh, wow, that's really cool. So you're spending a sizable amount of time just validating and revalidating your data. That's an amazing endeavor. So related to that, Isaac, I mean, how's your organization, DS4C, as a nonprofit organization, able to, create these large data sets and organize the hackathons that you've been setting up with Future Devices? And actually, before you even get into that, why don't you provide a little context about the hackathons that you've had already, actually, just to remind the audience here.
Sure. So we have held a couple hackathons with the Korean government. One of the things that we really wanted was for our data sets to be analyzed by people who weren't just researchers, because there are a lot of people in Korea who are very willing to put their efforts into doing something good for the public, and there are also a lot of people who have experience in data analysis. So even if people weren't part of a research organization that studied or that researched COVID-19, I wanted to expose the public to some of the works that we're doing, and which would allow us which would inform us how our data set is being used in a large scale, because often many of the studies are very pinpointed to a very specific topic, and it's difficult for us to get a large scale view of how our data is being taken a look at from a general perspective. So it informed us through that, and it also allowed the general public to share, because our data is in the form that is easy for data engineers or data analysts to take a look at, but isn't quite in a friendly format for individuals who are not data analysts to take an insight from that. So we essentially outsourced the part of converting our data sets to be something that can be practical and easily understood, even by the general public. And because people who came up with these visualization tools, or people who visualized data sets, weren't part of a specific research group, because they were coming from the perspective of the general public, they were able to publish some really meaningful results that many non-data analysts were able to take great insights from. And so after our initial hackathon, the South Korean government contacted us again with even a larger budget for us to initiate the second hackathon. And then from that, we worked with Korea's version of Kaggle. Can't remember the name right now. It's Dacon, right? We worked with Dacon, and we hosted the second COVID-19 dataset, which had about 11K worth of prizes, and a national prize from the Ministry of Defense or something. Yeah. So, sorry, Danny, could you ask the first part of the question again, please?
Oh, no, it's fine. So the first part was actually basically, were you able to create the large data sets? How are you able to do that, and then organize the hackathons with the huge prizes? But you've actually you've actually made me want to ask the next question, because you just called it out, right? You mentioned the South Korean government. How are they funding you now? Because what's amazing about what you've done here is that it's 16 basically students who went ahead and come together to build this effort on their own, and on your own, you went ahead and engaged with a lot of cool companies, Korean and globally, to create these hackathons, which is amazing, right? And then now the South Korean government is involved. So how are they funding you now, and why does this excite you? Like, how is it different now that the South Korean government's involved?
Initially, we weren't sure how to. We were collecting data and we were publishing it, but as the number of patients was exploding exponentially, we weren't sure how, or if it were even possible for us to go on and maintain this quality of data, or whether we'd have to give up on some data and only collect the parts of it that may not contain as much detail and research potential. But we were soon contacted by the Korea's Ministry of Science, Technology, and I think it was IT Communications, that they saw the utility of our data set, and they wanted to sponsor us in a meaningful way so that we could continue our work. And they also realized that the number of patients was growing exponentially. And so as a group of basically people who were not paid, whether we were students or whether we're someone with a day job, as people who couldn't dedicate all their time to generating this data, it would be difficult for us to keep up. So what they did was they sponsored us with a generous 67K amount of money for us to basically spend at generating the data. And what we did was we just kept going with what we did. Right? We were able to outsource a lot of our work, and we were able to generate the data engineering tool to make it easier. But the essence was identical in that we were stamping out, or we were just getting our hands dirty and trying to get as much of the data out there as possible. Because what we were concerned of wasn't like a month-long plan or a year-long plan of how to create an efficient data engineering chain. It was literally like, how are we going to copy and paste all the data by tomorrow before they're deleted, right? So the concerns we had were very down to ground, and because they were so down to ground, it was immediately related to producing the data. So I think one of the reasons why the software government, along with other organizations like Google and Databricks and Microsoft, the reason why they were so willing to help us was because we were concerned with delivering the product immediately, rather than creating a scheme or creating a potentially grandiose scheme. So yeah.
No, that's awesome. Okay, so we probably only have time for one more question. So so here we go. So tell us a little bit how else you're helping the data community. You mentioned the hackathons, just like you said, and you're making the data available in Kaggle. What are the other exciting things that your team is currently working on?
So of the many things that we'd like to go a little deeper into, just to give a very brief overview, because we're going to talk about them in the next talk. As we've mentioned, we're conducting a research with Databricks, and we're trying to implement one of the state-of-the-art Cyrus Plus models to our dataset, because unlike the dataset that is available, or that Cyrus Plus and many other machine learning models are built around, our dataset has more detail. So we're hoping that we're hoping that we could take advantage of the degree of details that our dataset has, and potentially create a more accurate and more insightful machine learning models. And that's only one thing we're doing. We're also working with many research organizations all around the world to provide them a tailored data set that they require. And obviously, this is not as traditional, or this isn't really commonly done, that people who use the data set request a specific set of data from the creators. But we see that the research that they're doing is not something that is only for their good. It's in the end for the good of everyone who's suffering from COVID-19. So we're doing it in the hopes. We're working with many organizations and providing them with this very specific research information or research data that they otherwise wouldn't be able to get access to. Another thing we're doing is we're trying to increase the reliability of our data sets, and even get more people to feel safer and more comfortable working with our data set by publishing our data set in a reputable journal. So we're trying to publish our data set in Nature Scientific Data. So those are the three things that we're working on so far, and we're going to dive deeper into it later in our next talk.
Perfect. Well, I mean, this is an excellent segue that was not planned, but yes, we will be having another talk on this channel concerning some of the research that's already been done on the DS4C data. So please be on the lookout. We'll be emailing that out relatively soon once we get it all scheduled, which will be in the next month or so. I want to say thank you very much to the DS4C team, to Isaac, definitely, for answering all of these awesome questions and presenting, but then also to everybody else in the DS4C team that's actually currently answering questions on the Q&A channel. So I really appreciate you all taking the time to do this. Vinny, you did an amazingly wonderful job on the Redash dashboard. Anything you'd like to go ahead and add in before we close up shop?
I was just saying thank you, Danny, for the opportunity, and it has been very wonderful working with the whole DS4C team. Looking forward to many more things. Yeah, thanks.
Perfect. Thanks, Vinny. Isaac, anything you'd like to add for last? Yeah.
So it's been a huge. It's been a lot of fun for us to work with you guys personally, and we're really grateful for this chance to openly talk about our data set with the dataset community. And thanks everyone for having interest in our data set. We really appreciate the questions you're asking, and we can't be happier that you guys are interested in working with our data set. So thanks a lot to everybody.
Perfect. Well, then I think that's it. Thank you very much, everybody, for taking the time to attend today's session. Again, thanks very much for the DS4C team for their amazing work. Like I said, we're going to be on the lookout for the next follow-up session where we dive into some of the research that's already been built on this awesome data set. And with that, thanks very much, and we'll see you around soon.